She was 22 years old. She taught yoga 3 mornings a week. She ate clean. She slept well. She took her vitamins. And on a Thursday morning in March, she woke up and couldn't feel her legs. I'm Dr. Alan Mandel, and in my 40 years of clinical practice, I've seen cases like this far too many times. Today, I'm going to walk you through exactly what happened to this young woman, what the doctors almost missed, and how you can protect yourself and your family from the same thing happening to you. Stay with me until the end, because what I'm about to share with you could quite literally change your life. Let me take you back. Her name was Emma, and when she first came into my consultation room, she was what I would describe as the picture of perfect health. 22 years old, graduate student, taught vinyasa yoga classes on Tuesday, Thursday, and Saturday mornings. She had abs of steel, she could hold a plank for 3 minutes, and her skin literally glowed. Everyone who met her said the same thing. Wow, you're so healthy. You look incredible. And she was healthy. I want to be very clear about that. She was doing everything right. She ate organic vegetables. She limited her processed food intake. She drank a green smoothie every morning, and she was taking a supplement that her best friend had recommended at a health food store. A supplement she had been taking for almost 8 months at that point. A supplement that millions of people take every single day without ever thinking twice about it. The first sign that something was wrong came about 3 weeks before that Thursday morning when she couldn't move her legs. She started feeling a little more tired than usual. Not exhaustion, just a slight heaviness in her body. She thought it was the stress of finishing her thesis. She mentioned it to her roommate, who said, "Yeah, you're probably just overworked." I think that's what it was too, because she didn't go to the doctor. She just pushed through. Then came the nausea. A couple times a week she would feel sick to her stomach after eating breakfast. Not vomiting, just this vague queasiness that would pass after an hour or so. She Googled her symptoms and found articles saying it was probably anxiety, stress, the transition to spring. She started doing more yoga to cope. She thought she was taking care of herself. Now here's what most people don't know, and this is so important. Those early symptoms were not random. They were the first signals her body was sending. In medicine, we call them prodromal symptoms, the body's way of saying, hey, something isn't right here. But because Emma felt so healthy, because she looked so healthy, she didn't take those signals seriously. And honestly, can you blame her? When you look in the mirror and you see someone who looks vibrant and strong and full of life, it's very hard to believe that something dangerous is quietly building inside you. The symptoms got worse. About 2 weeks before that Thursday morning, Emma started noticing that she was thirstier than usual. Way thirstier. She was drinking 2, sometimes 3 liters of water a day, and she still felt like she couldn't get enough. She would wake up in the middle of the night with a dry mouth, stumbling to the kitchen to get more water. She mentioned this to her yoga students, and one of them said, "Oh, that happened to me when I was training for a marathon. You must just be really dehydrated." So Emma started drinking even more water. She added electrolytes to her routine. She thought she was doing the right thing. By the way, that excessive thirst is called polydipsia, and it's one of the classic warning signs of a condition called hypercalcemia. That's when calcium levels in your blood get too high. I'm going to explain exactly why that matters in a moment, because it's at the absolute heart of what happened to Emma. But I need you to stay with me here, because this is the part that most people miss. About a week before the crisis, Emma started having constipation. Really bad constipation. She went from having a normal bowel movement every day to struggling to go once every 3 days. Her abdomen felt bloated and uncomfortable. She tried adding more fiber to her diet. She tried probiotic supplements. She tried magnesium, which is actually something I recommend for constipation. Nothing was working. But again, she didn't go to the doctor. She figured it was just something she ate or stress, or maybe she needed to drink more water. She kept telling herself it would pass. And here's the thing that keeps me up at night when I think about Emma's case. Every single one of these symptoms, the fatigue, the nausea, the excessive thirst, the constipation, was a breadcrumb, a warning sign that something dangerous was happening inside her body. But because these symptoms are so vague, because they can be explained by 100 different things, Emma, like so many people, kept telling herself it was nothing. It would pass. She was probably just stressed. Then came Tuesday night. Emma taught her regular vinyasa class. She was feeling a little off that day, more tired than usual, a little nauseous, but she pushed through because that's what she always did. Her students didn't notice anything unusual. She went home, made dinner, watched some television, went to bed. She woke up at 2 a.m. to use the bathroom, and she felt fine. She walked to the bathroom, she walked back to bed, she went to sleep. And then on Thursday morning at 7:15 a.m., her roommate knocked on her door because Emma hadn't come out for her yoga class. Emma tried to get up, and that's when she realized she couldn't. Her legs weren't working. They wouldn't respond to her brain's commands. She tried to roll over, tried to sit up, but her body wasn't cooperating. She screamed for her roommate, who burst into the room, found Emma in bed, confused and terrified and unable to move her lower body. Her roommate called 911. A 22-year-old woman who had been in perfect health, who taught yoga, who looked incredible, who felt great about herself, woke up one morning and couldn't move her legs. The ambulance ride to the hospital, the tests, the fear, the uncertainty. I can't even imagine what was going through her mind and her roommate's mind in those moments. This is why I'm telling you this story. Not to scare you, but to educate you. Because what happened to Emma is not as rare as you might think, and the warning signs were there the entire time. At the hospital, the doctors ran a series of tests: blood work, CT scans, MRIs. They checked her spinal cord, they checked her brain, they checked everything. And what they found was shocking. Her calcium levels were dangerously high. Through the roof. We're talking about calcium readings that were more than twice what they should have been. And that hypercalcemia, that excess calcium in her blood, was causing what the neurologist called acute neuromuscular dysfunction. Basically, the excess calcium was interfering with the signals between her brain and her muscles, especially in her lower body. That's why she couldn't move. But here's the question that haunted the doctors who treated Emma. How did a 22-year-old woman, someone so young and seemingly so healthy, end up with calcium levels that were literally life-threatening? How did this happen? And that's when they asked her the question that changed everything. What supplements are you taking? And she told them she was taking a vitamin D supplement. 5,000 international units every single morning. Her best friend had recommended it, said it would give her more energy, support her immune system, help her feel even better than she already felt. And she had been taking it for 8 months straight without ever talking to a doctor about it. Now, I want to be very careful here because I'm not here to tell you that vitamin D supplements are bad. They're not. Vitamin D is actually essential for your health. It helps your body absorb calcium. It supports your immune system. It plays a role in mood regulation, and millions of people do need to supplement with it, especially people who live in northern climates or who don't get a lot of sun exposure. But here's what Emma didn't know, and what most people don't know. When you take high-dose vitamin D supplements, and I'm talking about doses above the recommended daily allowance of 600 to 800 international units, you need to be monitored because vitamin D causes your body to absorb more calcium from your food. And if you absorb too much calcium over an extended period of time, and if you're not getting it checked with blood tests, you can develop a condition called hypercalcemia. And hypercalcemia, according to research published by the Mayo Clinic and the National Institutes of Health, can cause a whole cascade of symptoms that most people just dismiss. Fatigue, nausea, constipation, excessive thirst. All of those things that Emma was experiencing in the weeks leading up to her crisis. And in severe cases, when calcium levels get high enough, hypercalcemia can cause muscle weakness, confusion, and yes, even temporary paralysis-like symptoms where the muscles in your body stop responding properly to your brain's signals. I want to read you something from a study that was published in the Journal of Clinical Endocrinology and Metabolism. They looked at cases of hypercalcemia caused by vitamin D toxicity, and they found that in many cases, patients had been taking high-dose vitamin D supplements for months, sometimes years, without ever having their calcium levels checked. And many of them had no idea anything was wrong until they ended up in the emergency room with symptoms just like what Emma experienced. Now, Emma is going to be okay. I want you to know that. After several days in the hospital, after receiving treatment to bring her calcium levels down, after being monitored carefully, she started to regain function in her legs. It took about 2 weeks before she could walk normally again. And her doctors, once they figured out what was happening, had a very serious conversation with her about the supplements she was taking and the importance of blood work monitoring. She now gets her calcium and vitamin D levels checked every 6 months. She has a wonderful team of doctors overseeing her care. She is doing great. But here's what I need you to hear. Emma's story did not have to happen. The warning signs were there. The fatigue, the nausea, the constipation, the excessive thirst, all of those things were her body's way of saying, hey, something isn't right here. But because she felt healthy, because she looked healthy, she didn't take those signs seriously. And she was taking a supplement, a high-dose supplement, without any medical supervision or monitoring. So let me ask you something right now. My friend, I want you to stop for just one moment and think about your own routine. Are you taking any supplements right now? Maybe vitamin D, maybe calcium, maybe iron, maybe some combination of things you bought at a health food store or a pharmacy or online. Maybe something a friend recommended to you or something you read about in an article or saw in a video. And when was the last time you had your blood work done? When was the last time you had your calcium levels checked, your vitamin D levels checked, your kidney function checked? If you can't remember, if it's been more than 1 year, if you've never actually had those specific tests done, then I need you to listen to what I'm about to tell you very carefully. Because there are certain groups of people who are at higher risk for developing hypercalcemia or vitamin D toxicity, and I want you to see if any of these apply to you. Number 1, and this is really important, if you're taking more than 2,000 international units of vitamin D per day on a regular basis, you need to be monitored. That's the line in the sand. I'm not saying don't take it. I'm saying if you're taking high doses, you need to be working with a doctor who can check your blood levels regularly. According to the American Thyroid Association, the safe upper limit for vitamin D supplementation in most adults is around 4,000 international units per day. But that doesn't mean you should just take 4,000 units without knowing what your levels are. Work with your doctor. Get tested. Know your numbers. Number 2, if you have any kind of kidney condition or history of kidney stones, you are at higher risk. Your kidneys play a critical role in regulating calcium balance in your body. And if they're not working properly, excess calcium can build up in your bloodstream. The National Kidney Foundation recommends that anyone with a history of kidney stones or kidney disease should have their calcium levels monitored very carefully, especially if they're taking any kind of supplement that affects calcium metabolism. Number 3, if you're taking certain medications, specifically thiazide diuretics, which are commonly prescribed for high blood pressure, you need to be aware that these drugs can increase calcium levels in your blood. So if you're on a thiazide diuretic and you're also taking a vitamin D or calcium supplement, please talk to your doctor about this interaction. This is not something to figure out on your own. Number 4, if you have parathyroid issues, hyperparathyroidism or hypoparathyroidism, you are absolutely in this high-risk category. Your parathyroid glands control calcium regulation in your body, and any dysfunction there can make you more susceptible to both high and low calcium levels. The Cleveland Clinic has published excellent research on this. Make sure your doctor knows if you have any parathyroid history. Number 5, if you're a postmenopausal woman who is taking both calcium supplements and vitamin D supplements for bone health, please hear me. I am not saying don't take care of your bones. Osteoporosis is a serious condition, but I am saying that if you're taking supplements for bone health, you should be getting your blood levels checked at least once a year to make sure you're not accidentally pushing your calcium too high. The American Diabetes Association has published research showing that calcium levels and bone health need to be balanced very carefully, and that's something your doctor can help you with. Now let me show you something. I'm going to describe some symptoms to you, and I want you to really pay attention. These are the symptoms that Emma experienced in the weeks before her crisis. These are the warning signs of hypercalcemia that the Cleveland Clinic and the Mayo Clinic both list on their websites. And I'm sharing them with you not to make you panic, but because I want you to be able to recognize them if they happen to you or someone you love. The first symptom is persistent fatigue that doesn't go away even when you rest. Not the normal tiredness after a long day or a hard workout. I mean this deep, bone-level fatigue that makes you feel like you can't get out of bed even after sleeping 8 or 9 hours. If you have that kind of fatigue, especially if it's combined with other symptoms on this list, please talk to your doctor. The second symptom is nausea and vomiting, especially after meals. If you find yourself feeling sick to your stomach on a regular basis, especially after eating foods that never bothered you before, this could be a sign. Don't just dismiss it as stress or a stomach bug. The third symptom is excessive thirst and frequent urination. If you're drinking more water than usual and still feeling thirsty, and if you're running to the bathroom constantly, this is something to pay attention to. The Cleveland Clinic specifically mentions this as one of the hallmark symptoms of hypercalcemia. The fourth symptom is constipation. Now, I know everybody gets constipated sometimes. It could be something you ate, not enough fiber, not enough water, a dozen different things. But if you're experiencing persistent, stubborn constipation that doesn't respond to dietary changes or over-the-counter remedies, especially if it's combined with any of the other symptoms on this list, please see your doctor. The fifth symptom is confusion, brain fog, difficulty concentrating. Hypercalcemia affects the central nervous system, and when calcium levels get too high, it can literally interfere with how your brain functions. If you find yourself feeling foggy, unable to think clearly, forgetting things more than usual, or just not feeling like yourself mentally, this could be related. The sixth symptom is muscle weakness and pain. Emma was a yoga teacher. She was strong, but in the weeks before her crisis, she started noticing that her muscles didn't feel as powerful as usual. She thought it was just overtraining, but it was actually a warning sign of the calcium building up in her system. And the seventh symptom, the one I want you to pay the most attention to, is irregular heartbeat or heart palpitations. Calcium plays a critical role in cardiac function. When levels get too high or too low, it can cause your heart to beat abnormally. If you're experiencing heart palpitations, a racing heart, or any kind of irregular heartbeat sensation, especially in combination with other symptoms, please seek medical attention right away. That is not something to wait on. Now, I want to show you something on your own body. Right now, if you're able, I want you to look at your hands. Look at your fingernails. I'm going to teach you something that most doctors don't even know to look for. Press your thumbnail gently against the nail bed of your opposite hand for 3 seconds. Then let go. Watch what happens. Does the color come back right away, or does it stay pale for several seconds? If it stays pale for more than 2 or 3 seconds, that could be a sign of anemia or poor circulation, which can be related to calcium and vitamin D imbalances. This is something I check in my practice on almost every patient. It's a simple, quick indicator that your body might not be processing nutrients the way it should. Also, look at the whites of your eyes in the mirror. Do they look slightly yellow or jaundiced? That could be a sign of liver involvement. And while we're on the topic of the liver, if you're taking any kind of supplement, especially high-dose vitamin D or calcium, your liver is working hard to process all of that. The American Liver Foundation recommends that anyone taking regular supplements should have their liver function tested periodically. It's quick, it's easy, it's usually part of a standard metabolic panel, and it can give you incredibly valuable information about what's happening inside your body. All right, so let's talk about what you can do right now to protect yourself. I'm going to give you 3 specific steps. This is actionable. This is real. And I want you to actually follow through on at least one of these things this week. Step number 1, make an appointment with your primary care doctor and request a comprehensive metabolic panel with calcium, ionized calcium, vitamin D, and parathyroid hormone levels. Not just a standard blood panel, specifically request these markers. Say, I want to check my calcium metabolism and my vitamin D status. Most doctors will order these tests without question if you ask for them. The National Institutes of Health has published clear guidelines on what normal calcium and vitamin D ranges look like, and your doctor can explain where you fall on those ranges. Knowledge is power. Get tested. Step number 2, if you're currently taking any supplement, write down exactly what you're taking, how much you're taking, and how often you're taking it. Bring that list with you to your next doctor's appointment. Show it to your doctor. Ask them, is this dose appropriate for me? Are there any interactions I should be aware of? Is there any blood work I should be doing to make sure this supplement is working the way it's supposed to? Don't assume that because something is natural or sold over the counter that it's automatically safe for you at any dose. Supplements are powerful. They affect your body's chemistry. They deserve the same respect and monitoring that you would give any medication. Step number 3, pay attention to your body. Not in a paranoid way, not in an anxious way, but in a real, genuine way. Start noticing how you feel on a day-to-day basis. Notice your energy levels, your digestion, your sleep, your mood, your muscle strength, your mental clarity. And if something feels off, if something changes, if something persists for more than a couple of weeks, don't just push through it. Don't just Google it and convince yourself it's nothing. Talk to your doctor. The human body is an incredible, sophisticated, self-reporting system. It's always telling you what's going on inside. Most people just don't know how to listen. I want to tell you one more thing about Emma before we close. After she got out of the hospital, after she regained full function of her legs, she came back to see me, and I'll never forget what she said. She looked at me with tears in her eyes and she said, Dr. Mendel, I thought I was taking care of myself. I thought I was doing everything right. And I said, you were, my dear. You were. You were eating well, you were exercising, you were trying to take care of your health, but you did one thing that a lot of people do. You assumed that because something was sold in a health food store, because it was natural, because it was a vitamin, that it was automatically safe in any amount without any monitoring or guidance. And that's a lesson that a lot of people need to learn. Supplements are not candy. They are not benign. They can absolutely save your life if you need them and you take them correctly under medical supervision. But they can also cause serious harm if you take them in the wrong doses or without proper monitoring. The key word here is proper monitoring. Work with your doctor. Get tested. Know your numbers. Listen to your body. My friend, if this video resonated with you, if you learned something today, I need you to do one thing for me right now. Share this video with someone you care about. A friend, a family member, a coworker, someone who might be taking supplements without ever having their blood work checked. You might just save their life the same way I'm hoping this video might save yours. Knowledge is power. Information saves lives. Don't keep this to yourself. And if you want to learn more about how to optimize your health, how to understand your body's warning signs, how to work with your doctor to create a truly comprehensive wellness plan, I have another video right here that I think you'll find incredibly valuable. I'll put the link right down below. Go check it out after you're done watching this one. Remember, your body is always speaking to you. It is always giving you signals, sending you messages, telling you what's going on inside. Your job is to listen, pay attention, take action, and work with qualified healthcare professionals who can help you interpret what's happening and create a plan that truly supports your health. I'm Dr. Alan Mandel. Take care of yourself, take care of each other, and I'll see you in the next video. God bless.